Well, good afternoon and welcome to another digital health download update from the digital health team at the Western New South Wales Primary Health Network. This is our update for the month of April. We've scheduled it for today, the 31st of March, only because we've got upcoming long weekend, Easter break, school holidays, and I'll be on leave. So we've just brought it forward to the last day of March, but it is our update for the month of April. Just before we get started, some quick housekeeping. Type any questions you have into the chat box and we'll address them at the end. Everyone is on mute and the session is being recorded and will be made available on demand via our website and of course YouTube channel as well. First of all, I'd like to acknowledge the traditional owners of country throughout Western and Far West New South Wales and Australia at large, and acknowledge their continuing connection to land, water, and the communities in which we all live, work, and heal. And we pay our respects to the people, the cultures, and the elders, past, present, and emerging, and of course pay respects to any Aboriginal and Torres Strait Islander people that are present here for today. Our three sections for today's update. We'll first of all go through some latest news across the digital health landscape in Australia. And then our spotlight feature today is on Provider Connect Australia. And then of course, any time for some Q&A at the end. So let's get started with the update. So ACRM, there's a couple of updates from ACRM for this month, but I couldn't help but notice that they announced recently some practice standards for digitally connected rural and remote communities. And if you haven't had the chance to have a good read, highly recommend it. But they highlighted 6 areas from which to ensure you meet those standards. And they're broken down as the responsibilities of the healthcare professional, assessment of the community context, responsibilities of healthcare organisations, healthcare governance, healthcare service planning, and engaging with communities. But probably the standout for me is just that community context. And it's important to match the right digital tools with the right population and physical environment. Now, of course, for regional, rural and remote, that's very relevant depending on where we are. There's a big difference between your larger, high density of population regional hubs, like our Dubbo, Orange, Bathurst, for example, with access to services, access to infrastructure, that kind of thing. But as you get more remote and more rural, access to mobile technology for certain population cohorts, poor infrastructure, disasters as they come and go will affect those regions a lot more. So just very important to apply that lens when you're going about your business and providing healthcare, and consider the business viability implications of introducing potential digital health technologies in those areas where there may be low population density and fewer people around. You know, it's not uncommon, I go into areas and the majority of the population are an aging population. When I say majority, we're talking well over 60, 70%. And for those people, ask them, simply survey them, ask them how they prefer to engage with them. And yeah, most of it's not going to be digitally, it's going to be via other means. So tailor your operation and be mindful of that temperature, if you like. And the college urged doctors and nurses to act as mentors for community members who want to use or access services, and in particular, My Health Record. And we've seen this firsthand in some areas where now next month we're going to talk about as our spotlight the active script list and e-prescribing adoption and use in community. And we've seen time and time again when we're in that the community of healthcare professionals come together, in this case pharmacy, GPs, coming together, acting as mentors, advocating for the benefits, then we genuinely see a strong support and connected community in the space. Now, most of you might be familiar with this service already, but we've been prompted to raise some more awareness about its availability, and this is very relevant for ACRM members or non-members, but rural doctors in particular that struggle to get access to good advisory services, support services, in this case, dermatology. So the Acram Telederm and Allergy Assist service can offer you free expert dermatological advice within 48 hours of outreach. So it's available to all rural doctors and Acram members, providing you with access to thousands of education areas, dermatology resources, practical advice and education from experienced industry experts such as dermatologists, even a plastic surgeon and vascular surgeon apparently. So now all Telederm, so you got to register an account if you haven't already to use it, but you can earn CPD hours for participating in that because it's classified as educational content. So I think that's a huge bonus. So if you haven't had the chance to make use of it, I highly recommend it. Now, clearly, Acram members will have access to these hours recorded for them, while non-members can self-record as part of CPD home processes. So, and the link's there. Feel free to check it out. Now, a little plug for my colleague, Lisa Bowes. She's taken the lead on this one. But we have the strengthening virtual care capability in residential aged care homes expression of interest just go out. And it closes 5 p.m. 13th of April, so it's a small window. With Easter holidays, Easter break coming up, we may look to extend it if required. But this is open to all eligible residential aged care homes located within Western and Far West New South Wales, ideally focused on supporting aged care homes to strengthen their use. So the virtual capability uplift, use of virtual care, improving equity of access, timely access to clinical services for their residents, and supporting earlier intervention and reducing avoidable hospital transfers, particularly, in our regional and remote communities. Now, successful applicants will receive fit-for-purpose virtual care equipment, supplied at no cost, and more importantly, that training and support on how to use the equipment effectively by providing further support and using nominated virtual care champions. So the community of practice component will support those key developments, shared learning and practical implementation of embedding virtual care into routine workflows for patient care. So reach out to Lisa Bowes, and of course, all our website has all the information regarding application details. There's even an FAQ there as well. Now, token updates on clinical information system. This is for GPs in particular. We did get notification from our data extraction provider, PenCS, that still there's a couple of general practices, a good handful, 10 to 15 or so, that still haven't sent their site ID to PenCS as part of this integration. So now most of you, it's highly likely you've already gone ahead and implemented the configuration, the one-time configuration to set up PenCS as a third-party application. And you would have been given at the point of configuration a site ID. You need to email that site ID to PenCS support in order to move to the next stage. So there's plenty of support there. Reach out to PenCS if you can, but we'll reach out to you as well independently to raise more awareness that you need to complete that connection for data extraction. This will affect your PIP-QI. Okay, so it's very important. As for some of the other clinical information systems, this is a new one, Medical Director for them. I was pretty intrigued by the announcement recently because I would have thought that there would have been capabilities on the lab end, especially our local labs, Laboratory, of still connecting between the systems. If anyone has been through the trenches on this one, it can be complicated. So it's exciting to see this new e-requesting called Smart Connect from Medical Director, new pathology e-requesting capability designed to replace the manual paper-based pathology requests with a fully digital workflow. Now, it's no surprise that Helios Pathology Network Laboratory is the first integrated partner because they've had e-requesting for quite some time, and they've managed to put that to the test. Same with Australian Clinical Labs have their own e-requesting module. And for our BP users out there, this is not new news. You've had the ability to do this for a little while. So for the Medical Director users, I think you should look into this one because it's probably one of the most time-saving, secure and safe way to get that order, that reducing transcription error, you name it, integration happening. For BP Premier users, if you haven't heard, Livebird is now free, apparently. So look into that, especially if you've got any GPs who are on the fence regarding AI scribe tooling and testing and trialing and that kind of thing. This might be an opportunity now, especially if there's no out-of-pocket costs going beyond standard trial periods. This is a good option. And I think given the popularity actually of AI Scribe and its growth, this doesn't surprise me, and it's exciting news to see from BP. Secure messaging and HealthLink news. This is going to appear in every monthly update. There's a lot happening in this space, but last month, if you remember, we talked about the statewide referral criteria and the timings in March. Well, I've checked, it's now live. So if you go into the website, you've got the link there. It's very, very clear. They've got all the updated referral criteria for a lot of the certain outpatient services. There's going to be additional criteria released later in 2026 for cardiology, nephrology, respiratory and sleep medicine. So they're set aside for later, but the majority of services now have the updated and the new referral criteria. Now, in terms of the support, we're predominantly talking about base hospitals, Orange, Bathurst and Mudgee, that still don't have the HealthLink smart forms enabled yet. So you don't have to, if you're referring it into Broken Hill, Dubbo, you shouldn't have to worry. The smart form technology will default to address all the referral criteria. But for these other hospitals that haven't gone live yet, we still need to rely on making sure you're utilising good letter writer templates that are set up to prompt the GP to include some of that referral criteria. So just quickly, there's been an updated palliative care RTF file template for Western New South Wales. Again, check Health Pathways for that. Same goes for Breast Screen New South Wales. We've taken the lead from one of our neighbouring PHNs to create a local version that specifically talks about Western and Far West New South Wales locations. And again, check Health Pathways for that one. And we're also currently working on a more generic template to address most of the outpatient services and the referral criteria. As you can imagine, it's complicated. All right. So we're trying to figure out a way and consult with a lot of clinical advisors to make sure that the template is usable across the board, but still addresses the referral criteria and doesn't leave you hanging with a lot of patient referrals. Just quickly, the Health Direct video call platform. A lot of you would know that most PHNs, and we still support and have an account with Health Direct to give healthcare providers free access to a conformant video call platform for video telehealth services. So they're always making updates, CoView in partnership with Health Direct. And this new one's interesting. I just thought this was fascinating. It's called the Video Call Saving Calculator update. So this does allow you to estimate the environmental and patient cost savings of conducting virtual appointments. So it is based on the virtual health emissions measurement framework and offers two ways to model the results. So there's the simplified modified Monash approach for quicker estimates, or the more detailed distance-based approach. So look, I've not had a chance to look at it or fiddle with it, but if this is of importance, especially if you're having struggle getting traction to justify telehealth or save your patients valuable hip pocket money to not come to the practice and that kind of thing, this could be a good option to help empower your patients to consider a telehealth option. All right, so now onto our Spotlight feature. And as I said, this month, it's about Provider Connect Australia. We'll be having a more deeper dive, step-by-step registration process webinar set aside for the 28th of April. I'll talk about that later, but the catchphrase here is enter once, share to many. So this is the link just down below there on the slide. There's a direct link to the Provider Connect Australia portal, but it's also in Proda. So if you go to the Proda services page, right at the very bottom, there's a tile, branded tile, you'll notice the branding there. Provider Connect Australia gives you direct access as well, but it uses Proda as its authentication gateway to get you into the system. But what is it? Well, Provider Connect Australia is an initiative of the Australian Digital Health Agency, also known as PCA for short. And the little bit of interesting fact here is PCA started, it germinated, if you like, from initially performing an important role during COVID and the rollout of vaccine. It was the vaccine clinic finder, and that's how it got its start. There was a very quick rollout, tactical rollout, to develop a database, a directory of primary care providers, pharmacies who were able to advertise to the public as to the stockpile and ability to provide vaccinations for COVID-19, and that's where it got its start. And now it's evolved to form a very important role in the interoperability story and the story of Health Connect Australia, and making sure we provide a connection, a directory of healthcare providers to connect with their business partners. So it also streamlines registration and ongoing updates of business information, and enables healthcare providers to maintain their details in one place. So it's just enter it once and then publish and share to many, providing convenience. But that interoperability story is probably key here. And I know it's a term that has been brandished a lot of late, but it is instrumental. And that real-time connection to information exchange has to be enabled by connected systems. And PCA will sit in the middle to provide that information connectivity. So healthcare interoperability, if we get it right with the right systems, supports a safe, secure, efficient, and quality care in general. Now, pretty much all PHNs are on there as business providers now. I know that the Western New South Wales Primary Health Network, we are very much advocating that registering and publishing your information to us is the preferred method. We're going to be making sure it's a system requirement for future grants, commissioning services. So if you want to do business with the Primary Health Network with us, then we're making sure that you register with PCA, publish to us, because it's the safest, most secure, most real-time access to information, and we get notified. Every time you make a change, you update your opening hours or update a new GP on staff, we get notified, and so we can keep up to date with the most recent information. But it involves an ecosystem of connected providers that conveniently and seamlessly share all of that high quality information about you with people that you do business with. So synchronizing, validating, push and pull of information, reducing errors and duplication is the primary benefit, and then the single source of truth to connect everything together. But there it is in a visual diagram. You can see on the left-hand side the provider providing a healthcare service to the community, and in the middle is our Provider Connect Australia portal. And it's also connected to the HI service. So real-time confirmation, that validation aspect I talked about before, to validate the HPIO will import all that information about you with one click of the button. So that's why we recommend there's a stepped process in the registration. If you've got a HPIO now, if you manage your HPIOs through HPOS right now, accessing My Health Record, that kind of thing, then it's recommended you add the agency as a CSP link in there first, and then you can import all that information. You import, if you're on the National Health Services Directory already, then that you can input everything into PCA and use PCA as your central point at which to navigate and update the information. So it's not reinventing the wheel and recreating everything from scratch. It's importing what's already out there and validating and confirming. And then you can publish all that information to business partners of your choice. National Health Service Directory is the big one, of course. But we have New South Wales Health in our region has a directory that's linking through to it. We have the primary health networks, as I mentioned, secure messaging systems, so Consult Med is a good example, and even Telstra Health. So it's good exercise to look at who is in there and publish to as many as you can. So the benefits really are reduces duplication, saves time, streamlines processes, and improve awareness. Enter once, share with many, as I said. But let's face it, we don't like free text. We don't like having to manually type over and over again. If you can just do it once and do it by syncing with these existing systems that capture that data, we can have an improved connectivity and access to information. But how does PCA ensure security and data quality? Well, as I said, it uses PRODA. So in terms of access, once you determine ownership, delegation, administrative support of information into the system, you can do that via PRODA and HPOS. It's a robust audit log where the PCA system records who and when information has been modified. And as I said, limiting free text fields from users adding information into the PCA system. So where possible, completely, it is going to be based on information that's sourced from other authoritative systems. Now, the National Health Services Directory, PHNs, as I said, New South Wales Health, they're all currently advertised as business partners, but Lisa and I are going to reach out to you more specifically, if we haven't already, either in person or via email, over the phone, and take this time to think about some of these questions, if that's okay, and feedback to us at any point at the end of this update webinar. But we're really interested in understanding what business partners would you like to see in PCA. So the ones that I've just mentioned are there. If they're not there, but you'd really like to see published in PCA, we want to know. So it's your chance to voice a preference. I've heard feedback, aged care facilities, especially a lot of practices that do a lot of aged care support work. I've heard secure messaging directories and even pathology, radiology labs and that kind of thing. So put your vote in. We'd love to hear your feedback, because all PHNs are responsible for feeding this information back to the agency so that the PCA team can improve. Continuous improvement. It's getting information from you. We can't improve the system. We can't work with potential business partners out there if we don't know where the opportunities lie. So there are three questions that we're going to really get you to expand on and hopefully address. First one is, talk us through which three business partners you update your business information with the most. So just in terms of everyday operations, just what are the three business partners that you do business with the most for now? Why are they an important business partner for you? And what's the cost or impact of them not having your most up-to-date information? Okay, so it's a bit of a survey on who are the top three partners right now, which is slightly different to the earlier question about what's missing from PCA, and then we'll look at the gaps. As usual, support is always available with these sort of systems, and you've got two options. You can reach out to myself and Lisa. We're more than happy to visit you in person if you require some support step-by-step, or you can self-serve. We have an interactive PDF. You can just go to our landing page on PCA on the website, and you click on the registration link in that website, and there's also an interactive step-by-step guide that we've created, so you can take your time and make sure you're following due process. If anyone here is part of a larger corporate group or a more complex network structure of organisations and ABNs and that kind of thing and delegations, then it might be worthwhile reaching out to the Digital Health Agency support team directly, and that team are a better place to walk you through and take time to make sure you're doing that correctly. So just finishing up now with a reminder, continuous improvement education and training is always in hand and available to you. Remember to put digital health on your CPD consideration list. So this is a repeat of what I mentioned last month. It's just a reminder that consider the following CPD self-reported activities of completing e-learning digital health courses, conducting audits, and measuring outcomes, that kind of thing, or use digital health, even updating your address book, getting prepared for new secure messaging requirements, that kind of thing are all options available to you. And with the free training, the Australian Digital Health Agency is the best place to go. I've just noticed this morning, actually, there's a new course for nurses and midwifery. So it's called the Digital Health Foundations for Nursing and Midwifery Competency Preparation for Placement course. So this is a digital foundation course for nursing and midwifery, and highly recommend you check that out if you haven't already, for any nurses listening. But if you haven't checked out the online e-learning modules as a starting point, it's all broken down. You can see there's a bit of a screen grab here of all the different specialities and that kind of thing. There's also webinars as well. The agency deliver once in a while, podcasts. They've got their YouTube channel as well. So plenty of resources beyond just your local PHN. We have some webinars. As I mentioned before, we've got the next update. We will run in May on the 5th, so invites will go out for that soon. And as mentioned, on the 28th of April, we're going to run the Provider Connect Australia webinar. So that's going to go into a lot more detail about what it looks like when you register, the process and the steps, sort of taking our interactive PDF actually and breaking it down into a webinar form with screen grabs. So if you want to wait to follow till then, that's fine. But that's certainly going to be recorded as always, and made available on the PHN website. And don't forget our podcast, Let's Get Literal About Digital Health. More importantly, 3 weeks ago, we published a new episode, and I had the pleasure of interviewing Kieran McGuire, product lead for PCA from the agency, and he and I talked at great length about Provider Connect Australia, its purpose, its benefits, and more importantly, looking to the future and its role in providing that interoperability and the Health Connect Australia architecture and the role it's playing as a directory tool in that program. So please check out that if you've got some time to kill. It's about 50 minutes, 45 minutes or so, but it'll give you a much deeper dive learning into what's happening with PCA. What do I recommend for this April-May period? Provider Connect Australia. Check it out. Now, one thing I did skip over and mention is some of you, especially general practices, you may have been notified in our region from local LHD. They sent an email with a letter requesting that you update your listing in the National Health Services Directory. I think they reported that well over 40% or so had outdated information on the NHSD. So again, how can you do that? Through PCA. So, but you may have to also go directly to the National Health Services Directory forms and update some extra information that PCA can't provide. But my recommendation is to look at both and get that updated information sent through. Check health pathways, clean up your address book, look for the new templates, keep an eye, I'd say keep an eye on health pathways all the time. Look out for communications from the PHN with newsletters as well when things get updated. And then if you're an aged care home, look at the application, especially if you are in need of that virtual care uplift and support. There's a great opportunity to tap into some access to equipment, access to good training and community of practice support. Well, thank you for your time. It does bring our webinar to a close. So until next month for our update, thank you for joining me, and we'll speak again then.